Good morning, everybody. My name is Alan Ormsby, and I want to welcome everyone to our second annual conference recognizing World Elder Abuse Awareness Day. That's today, June 15th, 2022. And if you are not on mute, we would invite everyone to go on mute at this point, just so that it's a little cleaner for everybody. So we welcome you to this second annual conference. We all understand the importance of recognizing and preventing abuse, neglect, and exploitation of older adults and vulnerable adults. Indeed, our own Utah Governor, Spencer Cox, has signed an official declaration that June 15th, 2022 is World Elder Abuse Awareness Day in Utah. So today is Utah's Elder Abuse Awareness Day in collaboration with World Elder Abuse Awareness Day. Every day in Utah, people like you on this call recognize the importance of protecting vulnerable people from abuse, neglect, and exploitation. We want to thank the collaborating partners for today's event. Those are the Utah Division of Aging and Adult Services, AARP Utah, Utah's Commission on Aging, the Alzheimer's Association Utah Chapter, Utah 211, and Utah's Association of Area Agencies on Aging. We have a terrific lineup of experts and leaders as today's speakers, and each will introduce themselves as they present. Our keynote will be from Kathy Greenlee. She is the Senior Director for Elder Justice Programs Advancing States. And then we will hear from Grant Johnson, who is a volunteer with the Davis County Coalition of Abuse Prevention of the Elderly, also known as CAPE. We'll then hear from Lauren Saunders, the Associate Director for the National Consumer Law Center, and finally Candice Daniel, who is the clinical psychologist, board certified in Geropsychology. So we want to thank all of you for attending today, and we'll go now to an opening greeting from our Lieutenant Governor, Deidre Henderson.
Good morning. My name is Lieutenant Governor Deidre Henderson, and I want to welcome you to the 2022 Utah Elder Abuse Awareness Day Conference. First, I want to acknowledge how hard the past 2 years have been on our aging population. The COVID-19 pandemic kept seniors from social events, loved ones, and much needed social interaction. Even as Utah returns to normalcy, social isolation still impacts our seniors. Unfortunately, isolated and lonely people are at a higher risk for financial exploitation. Without social interaction, fewer people notice and report abuse and neglect. Education is critical to recognizing the warning signs for neglect, abuse, and financial exploitation. And with the right know-how, you can confidently take the next step to report issues to the appropriate agency. That's why I'm so thankful you're here today. The work you do at this conference goes a long way to prevent elder abuse. I also extend a heartfelt thank you to our frontline workers who all play a vital role in recognizing and preventing abuse in our communities. In particular, the dedicated Adult Protective Services caseworkers, senior and disability services staff, and caregivers. I also want to thank Utah's Health and Human Services Division of Aging and Adult Services, AARP Utah, the Utah Commission on Aging, the Alzheimer's Association Utah Chapter, Utah 211, and Utah's Association of Area Agencies on Aging for hosting today. Finally, thank you all for your dedication to protecting Utah's vulnerable adults. Enjoy your day of learning.
We appreciate all the support that we get from our governor and lieutenant governor, and now we will go to Kathy Greenlee. Kathy.
Good morning, Alan. Thank you so very much. I think, Rob, if you will help me with slides, that'll let me focus on what I want to do with you all. Thank you all for joining, and congratulations for hosting your second conference. I was there in 2019 when the Area Agencies on Aging had a statewide conference, and I came out to Park City and had an opportunity to speak with you then. So it's good to see you all again, those of you who were there. Let me tell you a bit about Advancing States before we start. Advancing States is the national association that represents the state departments on aging. Nels Holmgren from Utah is on our board. He's been very active with Advancing States for many years. We also represent the Medicaid programs in states that support aging and disability programs through Medicaid. So we have a very broad and national membership. I have been doing some work with advancing states since about this time last year. I served for 7 years as the U.S. Assistant Secretary for Aging in Washington from 2009 to 2016. And before that was the Secretary of Aging in Kansas for 3 years. This issue of elder abuse is best described as my passion issue, the issue that I am always pleased to work on because it's just so important to me personally, and have really committed a lot of time throughout my career to working on the topic. So I'm thrilled to join you. I have slides I'm going to go through, and I have given Tracy a heads up that I want this to be interactive. There's a few times I'm going to ask her some questions about Utah in specific, so I won't be surprising her. And also, I'm always glad to entertain questions either as I go, and I will leave some time to have questions at the end, but I want this to be informative, interactive to the degree that it can be with a virtual presentation and a lot of you who are here. So let's go to my first slide, my next slide, I guess. Rob, I just want to tell you a little bit of context about World Elder Abuse Awareness Day. The organization that really promoted it was the International Network for the Prevention of Elder Abuse, INPEA, back in 2006. I don't think INPEA is still around. I'm not exactly sure. There was a national group with a similar name. Things have really changed in the world of elder abuse, but these are the national and international advocates who really advocated for attention to elder abuse. And they were successful enough that the United Nations General Assembly recognized this day in 2011. So this is an officially recognized international day. And over the course of the last few years, as we've done work on World Day events, I think all of us realized that it would be better if we had a whole month. There are so many activities that happen around the nation now, thankfully, that we can't fit them all into one day. And as you all work to figure out how you can provide lift to this issue, please feel free to do anything in June and declare it part of our World Day activities, because this has been a wonderful opportunity to highlight the issue and bring additional partners into the conversation. This really was the brainchild of Professor Elizabeth Podnieks, who's just a delightful person. She used to teach at Ryerson University in Canada, and really is still very active and around working to promote this, and has been very pleased to see so many of the rest of us kind of take up the mantle and focus on World Day. I've given you the hashtag for today's World Day event. If you all are on social media and want to promote it, the Elder Justice Coalition does a lot of work and leadership. And then the National Center on Elder Abuse has tremendous resources about World Day, graphics, information. You still have time because it's morning there in Utah. If you want to quickly add something to social media or find some way that you can amplify the work today, you still got many, many hours to help us draw more attention. Next slide. So what I'm going to talk about today is kind of a national perspective on what's happening in states with regard to adult protective services. And then towards the end, talk about how what's happening with APS is related to community partners, because I know there are so many of you on this call today who work with Utah's APS and our allies like AARP, who's sponsoring the event. So I will kind of do both things. 10 years ago, the National Adult Protective Service Association, NAPSA, and my organization, Advancing States, did an all-state survey to capture what was happening in adult protective services 10 years ago. And the name of this survey I've put here was Adult Protective Services Increasingly Vulnerable. That was an interesting report because really Martha Rorty, our executive director, just decided to do it, to survey the states. And at that point in time, there was so little information about APS that this report is frequently cited as one of the best sources of information about what was happening with adult protective services in our country a decade ago. There are many things that have changed in the last 10 years, much more attention, much more involvement by the federal government, but it's still time to take a look 10 years later. So we launched a survey this summer. I'm going to give you some information about what we're finding with regard to what's happening with adult protective services around the country. And like I said, we're going to talk to Tracy a little bit about how this impacts those of you there in Utah. The survey covers general questions about adult protective services and also questions about self-neglect. The thing to keep in mind, because I'm going to give you some national snapshots, is every state is a little bit different. Adult protective services in this country has come a different pathway than child protective services. Child protective services have had federal money and support and regulations, dedicated funding since the 1970s. Adult protective services developed as a state-by-state initiative because states such as yours and all the states really felt a commitment to helping older people. So everybody built their own program. And so every state is a little bit different, but we can see trends and changes, even comparing this report that we did in 2012 to the report that we have now. So let's go to the next slide. I want to start giving you information about what's happening with adult protective services. Your lieutenant governor acknowledged how hard the pandemic has been on older people and on state workforce, frankly. One of the questions that we asked when we did the survey to adult protective services is what's happening with your workforce. We have an increasing number of older people in this country and increasing caseloads and referrals being made to adult protective services at a time when adult protective services staff have been really challenged by the pandemic, have had a difficult time getting into people's homes, and frankly, has just gone through a period of time that as employees, this has been a scary time to do the work. So one of the questions that we asked states was what's happening with the workforce? And I'm really pleased by the center bar on this, that for the most part, it's staying the same, which is the size is staying the same, which is good news unless your caseloads are increasing. There are some states that are seeing increases in their workforce size. I'm working with one state that has the opportunity to add more positions as they get more cases. So they have the slots, but they're having a hard time filling them because we have a worker shortage in the country. What's concerning, of course, is the green bar on the left, that you have states with increasing work to do and decreasing numbers of staff. So we ask states, well, like, why are people leaving? Which is what's on the next slide. It's interesting to see why there's turnover. One is burnout, which is not surprising for any year at any time for adult protective services work. This is hard work. It's stressful. It's just personally challenging, I think, the types of cases that we're asking adult protective services workers to respond to. Some people are retiring. Many people get better opportunities and better pay. We've been doing a lot of work, for example, the state of Kentucky, that really has been working very hard to do something as basic as raise the salaries of adult protective services workers because they were finding people leaving state employment for better opportunities. And the little blue bar on the end, is COVID concerns, is also important to pay attention to. That the workforce is generally not shrinking because of COVID concerns, which is good, but we are hearing from states that employees are afraid to go to people's homes now, that getting people back to doing the work and getting people back to returning to going to people's homes is a concern. Which is from sort of a big picture perspective really troubling because that's the nature of the work. Often the only people who visit with an individual, who see the risks or the abuse, are people who get into someone's home. And we need adult protective services to feel confident and supported so that they can return to work and go visit people in their homes. The next slide, please. The other thing that one of the other questions we ask about just in terms of adult protective services is how are you managing the cases? Because the cases are increasing and many times the cases are getting more difficult. And states have different ways of dealing with just how to assign the work and the caseloads. So as you can see, about half of the states that responded here just have all of the adult protective staff as generalists. Every staff does every kind of case, and they're just assigned based on kind of everybody having the same opportunity and challenges to work the cases. But then there are states who have, over time, experimented with different ways of really staffing the work. There are some states who have informally specialized staff. We're going to talk, I'm going to talk about financial exploitation. The following speakers will talk about exploitation. But there are states who say, you know, we've got someone who's really interested in and good at this kind of case. Informally, Joe's the guy who likes these cases, financial, people with Alzheimer's disease. So just kind of informally, that's where the cases are going to go. Then there are some formally specialized staff, like Joe's the guy. We've designated that he'll get them. And then there are states and even counties that run adult protective services who set up specialized units. We have a unit that works only on cases of self-neglect, and that I don't know what the 6 others are. I have to go back and read the results, because these results have just come in the last month or two. So there's really a variance in how states are responding to handing out the cases, assigning the cases. One more slide, and I'm going to ask Tracy about how you all are doing that. So then we ask, well, if you're specializing in the staff, how are you specializing? And if they're specialists, you're most likely to see it in situations of financial exploitation. This is one of the fastest growing aspects of adult protective services work. And the financial exploitation cases can be technically difficult. They can be complicated. They take a long time to work through. Other states are assigning specialists to work for people experiencing self-neglect, for people who have dementia and Alzheimer's disease, or people with mental health challenges or mental health needs. Tracy, I have your survey results. I know what you're doing, but why don't we talk about, you know, how you are staffing adult protective services there with regard to needing people to do really hard work, and some people need to specialize.
Great, thanks, Kathy. Yes, overall, I would say we're a generalist state in that because most of our state is rural, as far as our geography, we have some limitations there. So overall, I would say we're a generalist state. However, we do have licensed clinical therapists on staff that when we get some of our tough self-neglect cases, or we have high recidivism, we assign those to our licensed clinical therapists to provide that extra support. Same with mental health. If we have somebody that is really struggling with mental health, we've seen a lot of cases with them, they're really in need of additional services. We assign those to our licensed clinical therapists. We are looking at a financial exploitation team, but we have not implemented that. It's just something that we've been looking at the last year and deciding if that's the route we're going to go.
Cool.
Because financial, as you mentioned, you're going to talk about financial exploitation,
Yeah,
but in Utah, that is the highest allegation and has been, I think, 9 years running now. Yeah. That's reported to us.
Right. That's not surprising. Okay, stay tuned. I got a couple more slides that kind of follow this theme. So not only do states kind of designate specific people, specialists, but states also, when assigning the work, sometimes kind of weigh the cases and say these cases actually take more time. So even if you have a generalist staff, Tracy, like you're talking about, it's like, oh, I've got a real increase, I've got a real complicated case that's coming. I'm going to assign fewer cases to the person who's handling this type of case or this particular case. So we ask states, are you weighing the caseloads? Most say no, but there's a significant number that do kind of measure that as they're assigning the work. And then we ask, well, which cases do you consider to be weighted the most heavily? Which ones are the most complex? And those show up on the next slide for us, Rob. And they're not surprising that this is, you know, what I guess everybody kind of knows who does the work, that financial exploitation cases can be very, very difficult. Self-neglect cases, and I'm going to talk a good deal more about self-neglect, can be really complex. Cases that come in where the alleged victim is experiencing multiple types of maltreatment, mental health cases, people with chemical dependency or cognitive impairment, those cases can simply take more time for staff. And so as cases are assigned, can be accommodated. So yeah, I don't know if you have anything else you want to say, Tracy, just as we're talking about staff and waiting, but we know that there are some cases that are simply harder to do. All right, let's keep going. I'm going to talk about numbers soon. Oh, MDTs. No, let's do MDTs. I want to talk about multidisciplinary teams. So the elder abuse is so complex that over the course of the last 2 decades, states, and not just adult protective services, but states have used different interdisciplinary mechanisms to work on the cases. And multidisciplinary teams are just the newest version, but they're not the only kind. There are the National Sheriff's Association has an initiative called Triads, and Triad is not an acronym. These are programs in communities, and Triad means 3, of course, where you've got adult protective services, law enforcement, and community members working to provide education and support to adult protective services and education to the community. There are FAST teams, financial abuse specialty teams, where you have adult protective services and law enforcement working on the financial abuse cases because they're so complex. Multidisciplinary teams are the newest version of teams that are put together to handle complex cases with a full complement of professionals. And so those teams would have at base adult protective services and law enforcement, but they may also include a geriatric psychiatrist, a mental health professional, other kinds of professionals who can help provide information about what interventions could best support someone. We really saw an increase in multidisciplinary teams about a decade ago when the Elder Justice Act was passed, and the Department of Justice has taken the national lead in providing technical assistance so that states can create MDTs. We also ask, I don't have a slide for this, but we ask states, how are you engaged with MDTs? There are some states, adult protective services are the lead entity, some are partners, some just refer on occasion. Tracy, you told me that you all are working with MDTs. In what capacity do you have those established there in Utah?
We are fortunate to have a grant through the Office of Victims of Crime, which has allowed us to have a grant coordinator who's on this call, Rebecca Beaumont.
Yeah, Rebecca.
Many of you know her. Yes, congrats. And she has done very well in collaboration with our area agency on aging partners. We partner with them, and we've broken up. Utah has 12 area agency on aging, and we have MDTs in 11 of the 12 areas throughout the state. So with the exception of one area, everybody has access to an MDT that serves elder justice needs and to be able to staff these complex cases and work together because no one agency can do it alone. So it is a great collaboration and a great partnership with our community.
I'm curious because we're talking about financial and I will talk about this some more. Do you have financial expertise on an MDT as well? I think of them more as like geriatric clinical people.
Yes, we do. So we have an internal financial auditor, and then we also have a contracted financial auditor in state of Utah through one of our other grants. And so between the two of them, they serve on all of our MDTs.
Cool. All right. Next question. Thanks, Tracy, for playing along. I appreciate it. I am also, so I think Eden's helping my slides now, Rob says. So we could go to my next question where I ask about clinical people. Elder abuse and self-neglect in particular has a healthcare component. There's a need for adult protective services often to refer or somehow include the expertise of clinicians. And so I was just like, Kathy's personally curious about this question. It's like, okay, APS, do you have access to clinical experts? And the answer on this slide troubles me that half of states do not have access to clinical experts when working on cases of abuse. The ones that do either contract with clinical experts or employ clinical staff. But Tracy, I think you just said you have access in your state to some clinical experts because there are cases where you simply need someone to help I've heard that there, some cases they have nurses who do case consultation. Sometimes the nurse needs to call a doctor to get attention. Sometimes go out to the home. Do you have access to clinical people?
We have 3 licensed clinical social workers on our team when we're fully staffed, but we don't have access to nurses. We rely on our partners to do that.
Right. So partners, it's an important thing to be aware of, that there is a clinical component that APS addresses in terms of the needs of individuals. So that partnership with you all is really essential. Now I get to talk about data, which is one of my favorite pieces. And I didn't start with it because I want you to be really awake when we talk about data, but I want to talk about the national data. When I was first appointed assistant secretary, even we can go to the next slide. When I was first appointed assistant secretary and moved to Washington, there was not any national data to tell us what was happening with state adult protective services programs. Every state had a database, but there wasn't a way to capture the data nationwide. So this is something that we built. The Administration for Community Living is the home for this database, the National Adult Maltreatment Reporting System. And they have now been reporting back to us for 5 years, national data. And I have pulled for you then a comparison of the most recent 2 reports, 2019 and 2020, because what's on this slide is very concerning and should help focus our attention on where we're directing our resources. Most alarming to me is that half of the cases are cases of self-neglect, where this isn't an issue of a perpetrator and a victim, but a situation where adults and older adults are living often independently and living in a way that is at risk to themselves, their health, and their safety. I've got a definition I'll show you soon, but half of the cases are self-neglect. And this is not a law enforcement issue. That self-neglect is really an issue where we need a different type of interdisciplinary, multidisciplinary approach, and we need longer term supports. So those of you who are allies with APS are essential as we figure out what we can do as societies and as states to support people experiencing self-neglect. And like the asterisk said, there are cases that have multiple types of abuse, so you can't add these numbers up to 100%. But the next 2 highest categories, a quarter, are neglect. And this would be neglect, and the difference is that there's likely a caregiver in the scenario that is neglecting the person that APS is supporting, and then exploitation. And Tracy, that's what you're saying in your state is the highest and increasing number is exploitation that you're seeing, the financial exploitation, because I think you don't handle self-neglect cases in the same way. There's a definitional difference, I think, in Utah that would make these numbers a little bit different in your state.
Correct. Yes, financial is the highest. Neglect is always second or third. It flips with emotional abuse as to which one goes second or third with caretaker neglect. And yes, self-neglect, I think because of how we define self-neglect, in Utah, it's lower. It falls in our mid-range of allegations reported.
Okay, thanks. All right, so I want to talk about self-neglect, and I just want to alert you that this is a little bit of a soapbox. It was a lot of bit of a soapbox issue for me. So Eden, let's look at the next slide. I don't like the language. I'm on a campaign with all of us to really reconsider the language that we're using. And I have a citation there at the bottom of this slide, because I've done a lot of reading about the research on self-neglect. And the experts feel that self-neglect occurs in those who lack mental capacity, and it's not a choice. I consider it an outcome of choices, but not a choice itself. I'm not willing to just agree or concur that people choose to self-neglect themselves. They may choose to live independently with 50 cats and no running water. The outcome of that may be self-neglect, but it is not the same thing as considering that people are like choosing to live this way. One of the other problems I have with self-neglect is it's a pejorative term. It expresses contempt or disapproval. This is not something you want someone to say about you. This is a negative way to characterize people. And it really connotes that there's an intentionality. I'm a lawyer by training, and it's like, I won't concede that this is an intentional situation. It may be the outcome, of other intentions, but it makes it sound like people like they want to live this way. The other problem is that when we talk about cases of self-neglect, that's not a person-centered description. And I've done a lot of work and provided a lot of national leadership in kind of the shared space of aging programs and disability programs. And I learned a lot from doing work with people with disabilities and my colleagues in the field of disabilities. And I learned a ton, especially around language. And at base, if we use language to describe someone, and that language is not something that that person identifies with, it's not the right language. That no one is going to say, well, this is me. I'm a self-neglector. That's not the language to use. And in an example that's really just simple and a completely different example, it's one of the challenges in working with family caregivers, which is not a pejorative term at all. But part of the challenge in doing outreach and aging to family caregivers is people don't wear that label. So they don't know you're talking about them. So self-neglect is just really not the right term. The problem is, I can't tell you what is. That we're talking about people who are living and experiencing, like poor health, real trouble in their lives, unsafe situations. And so I don't have a suitable synonym and can't like fix this problem other than to recommend this, that we at least use person first language. And that when we're talking about self-neglect, we start to shift to see that self-neglect is the outcome, that this is a person who's experiencing self-neglect. And think about what you have read or heard more recently with regard to people experiencing homelessness, that you do see language change in social services as we start to kind of go back and say, well, there's a person here. Let's focus on the person and then address the situation that we're concerned about that the person is experiencing. So this is me on my soapbox, hoping to get you on the bandwagon, so to speak, to say, let's talk differently about this situation. And if any of you ever find a better synonym, something else that we should describe, I'd be glad to hear it. Since we're talking about World Day and this elder abuse being an international issue, I asked some of my colleagues who do international elder abuse and aging advocacy, I asked them this question. It's like, well, what happens with self-neglect around the world? You tell me about self-neglect internationally. And here's what they said. Ready? Watch me. It's like, well, sometimes it's called poverty. Sometimes it's called dementia. In some countries, this is not a thing. They probably have people experiencing what we're talking about, but it's not considered this. And so I don't know where we go. I don't know what we will land on in 5 years. But one of the first steps we can take is to at least start talking about these are people experiencing something who need assistance. Next slide, please, Eden. All right, well, here's the definition. It's an inability due to physical or mental impairment or diminished capacity to do self-care. And the self-care is all listed here: food, clothing, shelter, many of the things that those of you who are community partners here help provide. Someone who can't get goods and services necessary to maintain their own mental health. When you talk to the general public, people who don't know really anything about elder abuse or self-neglect, sometimes the only way to connect with a layperson on this topic is to mention hoarding. And then they go, oh, the person with 50 cats. It's like, well, yes, that is an example of someone experiencing self-neglect, but it is not the universe. That hoarding is an example, but this is much more complex. And just the situations are way and well varied from this. Let's do my next slide, Eden. Will you skip forward a slide and come back? Promise me I need to come back. When we talk about like, what are the characterizations? How would you kind of categorize what's happening in someone's life when they're experiencing self-neglect? The research really points us to these three things. So when I say the general public, a layperson may only think about hoarding, it's really these three aspects. Someone who's got a challenge with personal hygiene, who has impaired function, likely mental function, but also could be physical function, and the environment they're living in reflects neglect. And those are the common 3 factors that have been experienced, that have been identified for someone experiencing self-neglect. Okay, let's go back a slide, Eden. And the health outcomes are well known, and part of the reason, because this is my soapbox, that I'm very concerned about making sure that Adult Protective Services has access to clinical experts, that people who are experiencing self-neglect have higher rates of mortality, poor nutrition, functional decline, the more likely to be non-compliant with medical treatment. I'm not a fan of non-compliant, but you get what I mean. Increased hospitalization, readmission to hospitals, increased use of emergency rooms, increased use of hospice, which I think is interesting, and nursing home admission, that it's not healthy for people to live this way. And there are healthcare implications for doing so. Now let's skip forward 2 slides, because we did this one. So where I'm going with all of this, and one of the reasons I wanted to show you the data on both self-neglect and neglect, is that the characteristics of both neglect and self-neglect demonstrate that these are conditions that are chronic, not acute. These are long-term problems that individuals live in. Adult Protective Service is designed for short-term solutions, for emergent problems, not for long-term support. People experiencing self-neglect, in cases of self-neglect, have a high percentage of recidivism. They return to APS, and that kind of reveals what I'm saying, or demonstrates what I'm saying, that these are people with long-term needs. Adult Protective Services, we have asked Adult Protective Services to do quite a lot for us in society, in going out to respond to situations that the public or professionals are concerned about. And there can be a great deal of frustration, honestly, with APS. And that frustration can come from a couple of things. One, people expect Adult Protective Services to act like Child Protective Services. Yet all of us as adults have autonomy, and we can make the decision to live in a way that no one else would agree with, but we have the right to do it. And unless a court has taken that right away, we are legally allowed to do it. So I know, because I work in a lot of states with Adult Protective Services, and I know that, for example, some community partners, some of the best community partners, can also voice frustration. And that frustration, I think, reflects this just basic human desires, like, can't you do something? It's like, well, sometimes no, hospitals and professionals can, it's like, okay, this person's coming in and out, can't you kind of like go fix it? And unless you're suggesting that the person needs to be placed under guardianship, which is a really difficult outcome for individuals, to remove all of their rights, there are just limitations in what APS can do. And some of that is just based on the autonomy and the ability of adults to make their own decisions. But some of it is based on the fact that we're asking for a short-term solution for longer-term problems. And that much of the most recent innovation and attention with regard to Adult Protective Services and the rest of us is, all right, when you've done your work, when you've gone in, gotten your staff to go back into the home, you've done the assessment, you've put together the service plan, you need to hand it off. And we all need to be there for you. We need to provide the longer term supports, because it's from those longer term supports that we can provide the best interventions for people who are experiencing self-neglect or neglect. Next slide, please, Eden. This is a complicated slide, so I have to explain it to you, okay? Because I don't know that I don't trust that the slide is self-explanatory. So I'm going to talk about the left side first, this little bar chart. In our national survey, we asked the states this question: for all of the clients in APS, what percentage of those clients need case management after you've closed an APS case? So who needs more help, especially case management? So the chart on the left is answering about all clients. So the green chart says, the green bar says, well, in 22 of the states, 22 of the answers, 0 to 25%, let's just go with the 25%, in about 25% of cases, of all cases, after they're closed, they need ongoing case management. And then the numbers decrease to the light blue, where there were at least 4 states who said, we think like 3/4 or everyone needs support beyond the closure of APS. So the thing to keep in mind on the left side is for all cases, there are a lot of states who feel like at least 1/4 need help, and then it kind of declines. States disagree about whether or not like everyone needs case management. The side on the left, on the right, I'm left-handed, so I get these directions mixed up. Still, the side on the right, we asked the question, okay, no, I've got a nice typo on there, I'm sorry, for case management for clients experiencing self-neglect. So for self-neglect cases, people experiencing self-neglect, how many of those individuals need help after you've closed the case? And look at the differences between the right side and the left side. States uniformly think, whichever color bar you pull here, that more people need support after a case is closed if they've been experiencing self-neglect. And this kind of demonstrates the point I'm making, that these are long-term chronic problems and they need community partners to work with in order to continue to serve these individuals and just as a society to provide the support. Okay, Eden, let's keep going. We also asked, what are the most common services? And this was a general question about all adult protective services cases. Through the National Adult Maltreatment Reporting System, the database that I described, there's a whole list of maybe 24 different services. And so when we did our survey, we asked states to just pick the top 5 because they really range from like everything. Cleaning out the house not be on the list, but this is what's most common. These are the kinds of services that APS needs to contract with or refer to in community, because this is what the people they're serving need: in-home assistance, bathing, grooming, dressing, Medicaid management. And what's interesting about the very first bullet is that assistance describes most of the common services available in a state under Older Americans Act programs, and often many of the services that are available under a Medicaid waiver. People need case management or care management, housing and relocation services. States recently received a lot of federal money, the American Rescue Plan money, for both building out their home and community-based services programs and to support adult protective services. And last fall, I had the chance to read 40 states' plans for how they're spending this big infusion of federal money. It's like, okay, APS, how are you going to spend this one-time big pot of money? And housing was the issue that states identified the most: the need for temporary housing or relocation services. Some states are looking at elder shelters. Others are looking at contracting with a hotel so they can get someone safely out of their home. But housing and relocation services, it didn't surprise me that it showed up on this list as one of the top 5 services. Emergency assistance and material aid services. This is really the core of what we've built APS to do. We need someone to get in right away and provide emergency assistance and aid. I did a home visit. I live in Kansas City. And I did home visits both on the Kansas side and the Missouri side of Kansas City a few years ago. And with my Missouri colleagues, we visited the home of a woman experiencing self-neglect who had no running water and very little food. And the wonderful adult protective services staff who were there, I was just riding along, went to their trunk and got groceries. It's the emergency assistance and material aid, the things they need to go get right now. That is identified as one of the top services. And then medical and dental services. Again, kind of an illustration of the key need to partner with those of you who work in a medical world to provide healthcare services. Okay, let's keep going, Eden. So there's been a lot of change, and I focused a lot on what we are learning from doing this survey 10 years after the first one. But during the time that I was serving in Washington and with the work that I did and my colleagues at ACL and people across the country, we've really seen quite a lot of activism and focus on adult protective services and elder abuse in the last decade. currently, the Administration for Community Living is focused on the issues that I've been talking about here. They're transitions from adult protective services to community services. What do we do to connect to community? And I want to give Tracy an opportunity to do a commercial, because this is a competitive discretionary grant, and you have one, where the APS program in Utah is working with your area agencies on aging to develop an innovative practice to address caretaker neglect and to provide resources. The world of adult protective services is a little different from, well, many ways different than child protective. But one of the understandings I think that people have is that sometimes you just have to lay aside blame and look at problems. And if there's a caregiver who's doing their best badly, what can we do to help them do their best well? And spending time focused on caregivers is worth it, because caregivers really are the backbone of the care we're providing. And so the innovation that you all are working on there is offering case management services to clients. And this is an example in Utah of what's happening in other states. Oklahoma has a similar grant that states are now saying, wait, we have to look beyond APS. We have to look at when the case is closed. So Tracy, will you do a commercial for yourself? Because I'm very proud that you all have gotten this discretionary grant.
Sure, Kathy, thanks. I didn't prepare for a commercial speech. Let's see.
You can do a commercial.
Yes, we have been fortunate to have one to be partners with the Benjamin Rose Institute on Aging, and they are based out of Ohio, and also with our area agency on aging. And we are doing an innovative study on caretaker neglect allegations. So after APS closure, how can we improve outcomes for not only the victim, but the alleged perpetrator or caregiver in this case that was reported to APS? How can we improve outcomes, social outcomes, mental health outcomes, physical outcomes, so that both the victim and the perpetrator have the resources that they need and they will be assigned enhanced case management, and see if we can connect them over a 4-month period to additional resources to see if this enhanced case management can make a difference. And I think what makes this unique is that we are the first state where we are actually working with people who are considered perpetrators, who they no longer are because the APS case will be closed, but we'll be working with caregivers who were alleged perpetrators on cases. And this will be unique for us. And so we're really excited. We're just getting this study up and going this month. We're going to start field operations next week. So next year, maybe we'll be able to report some great data and outcomes from it.
Congratulations. Discretionary grants are hard to get. So federal grants. Okay, let's keep talking. I'm gonna what will feel like maybe race through the next couple of slides. Eden will help me do that. There's so much innovation in this field, and I work on a variety of projects, and I just want to tell you about this one so that I can get to the next slide to make a point. I'm involved in something called a National Collaboratory to Address Elder Mistreatment, and I've given you reference information so you can find it. The John A. Hartford Foundation, Gary Mary West Foundation have funded a project for the last 6 years to find and develop a screening tool for emergency departments to screen for elder abuse. And they've worked with some of the leading geriatricians in this area in the nation. Laura Mosqueda out of USC, Carmel Dyer and Jason Burnett out of UT Health in Houston, and then Mark Lax, Tony Rosen at Cornell in New York. And so we have some of the best minds in the country who've been working with hospitals. So I wanted you to have this in case you're from a hospital or you want me to tell you more about this later. We won't have time today to say there's now a validated tool for hospitals to screen for elder abuse. It doesn't cover self-neglect. This is specifically focused on elder abuse. But what we've learned in working on this collaboratory is if the hospital is going to screen for elder abuse, they will find it. And then they need to refer to the community. So my role in this, because I'm not a clinical person, was to help on this third component, which was how to build community connections. And there's a resource I've given you that is designed in this way. It's really the referral source for hospitals, but it's a rich resource on how a community could convene an entity that could address the issues of elder abuse when they're referred from the hospital. Next slide for me, Eden. And here's what I want you to know. It includes all of you. I don't know all of you, but I know your community partners as well as APS workers, that there's information in this community connections, that it's important that you know who does these things in your community, who's from the aging network, who's providing health services, public safety, housing, clergy and faith communities, EMS, that as we started working on this, we thought, you know, one of the very best things a community could do is get together, even with people that you know, and say, when do you see abuse and what are you doing? And just go around the room so that you all know what you're doing to catch duplications and gaps. And there's information in this toolkit that I think could be instructive to think about what you're doing. Like one of the issues that we identified, and we've talked about here in terms of access to clinical support, there will be a time that the community or adult protective services or one of you will need to know the answer to, yeah, Diane, we'll get you these links sent you. We'll need to know the answer to who does a capacity evaluation for this person, you know, who provides us the housing support, because that showed up on the list. That these community connections are essential. And we have spent some time kind of giving some guidance on the kinds of things that you could look at. Yeah, these are not hyperlinks, I don't think, in my slides, but we'll get them to you. So let's do the last slide because I want to leave at least a couple minutes. Many years ago, as I started working on elder abuse, I came up with something I call my 3 questions. Because I've spent a lot of time trying to figure out at a macro and micro level, what could we do? Each of us, what could we do? I would be happy if you knew of one thing to do differently tomorrow. So here's my 3 questions and the purpose of them. First question I will ask you is, are any of the older adults you know abused? And here's what you should do. You should go. Because 1 in 10 older adults are abused. This is a question about prevalence. And I do a lot of public speaking where I only talk about this first question and talk about how pervasive this is. The second question, do you know who they are? This may be the hardest question of the 3, because this is about screening. There are very few entities that actually look for abuse. The people most likely to see it are people who get into someone's home and notice it. So who are the people? If you know because of prevalence that you must know someone, if you know more than 10 people, I must know an older adult who is abused. Who is it? How do you know? And there's lots of screening tools out there and different ways that you could approach this. But for your purposes today, ask yourself the last question. What do they need from you? Because I think that's what the core is. I think that's what will change this the most, is that if all of us can answer that question, not what should we do for them? We don't want to be, we don't want to be paternalistic in our approach, but really understanding what do they need from you? If you don't know that answer, I would suggest you ask them. So like if you're a bank and you're on the call, then, and you don't know, I don't know what they need. I don't know what they need my tellers to do. Convene 24 of your clients and ask them. That if all of us simply understood what our role was when we encounter someone who needs help, we could really make a difference in people's lives. And that's my call to action for you. Figure out what do they need from you. And these are not easy questions, and you may need to ask them. The work needs to be better informed by people themselves who are going through this. I've got a last slide that has my contact information. You're always welcome. Let's do the last one, Eden. So, and I'm reading the chat at the same time. That's how you would email me. Bonnie, you have in the chat that you appreciate the term elder mistreatment as elder abuse. Part of the reason for the difference in this is the issue of self-neglect. Self-neglect, some people don't consider to be, let's take my slides down. Could we grab this? Eden, will you put this address in the chat for everybody to read, and we'll take the slides down. That elder mistreatment is the broader of the 2 terms, and elder mistreatment can include elder abuse and self-neglect. Elder abuse itself, we can debate whether or not that includes abuse. Other comments or questions, and I know we're at time, Tracy, but I do want to be cognizant. I put the slides together, and I don't know that those will be hyperlinks, but we can follow up and get those. The URLs that I've listed are correct. Do you all have other questions, thoughts? I'm not going to run us out of time because I know we've got more speakers, but I appreciate your attention today.
Kathy, we'll be sure to encourage and capture questions as follow-up as well, and have an exchange that we
Okay.
can share with the group. And they
Okay.
will all have access to the recording as well.
Good. Okay. All right. Very good. I'm just looking. Eden is dropping the hyperlinks in so that you can follow those to get those resources that I've given you. All right. Happy World Day. Now, I'm just looking around, and I appreciate you all. There's only one thing that we need to do better. It's purple. Purple's the color. Got your purple on. Get your purple on. All right. Tracy, thank you.
Thank you, Kathy. Deep appreciation for your time. We have a slight shift in schedule. We're going to hear next from Lauren Saunders and Lauren, so I'm going to go ahead and share the screen and your slides and have you introduce yourself and start your conversation.
Thanks, everybody. Again, thank you for inviting me, and thanks for all of your work on this incredibly important topic. Let's see if I had, so these are your slides. Okay, you're advancing them. Okay, so next slide, please. I'm Lauren Saunders with the Associate Director of the National Consumer Law Center, and NCLC works for economic justice for low income and other disadvantaged people. We do this through policy analysis and advocacy, including a lot of regulatory and legislative work, publications. Our publications are mostly aimed at lawyers, like our consumer banking and payments law treatise, but we do have some like surviving debt that's more aimed at a lay or professional audience. We do a little bit of litigation, and we do training and technical assistance for lawyers, advocates, and policymakers. We do not directly assist consumers. We are more lawyers to the lawyers, lawyers to the advocates, the policymakers, the others who are serving the consumer population. Next slide. So I'm going to be talking about payment fraud, which is one of the areas that we work in. And I'm sure it's no surprise to any of you that scams are exploding. Last year, nearly 3 million people filed complaints to the FTC, reporting about $6 billion in losses. And that is certainly an understatement because, of course, not all scams and fraud are reported. That was nearly double the amount of losses that were reported in 2020, which itself was a peak year compared to the prior year. And looking into a sneak peek of 2022 at the first quarter, the losses reported the first quarter of 2022 are nearly a third higher than they were last year. So unfortunately, I think 2022 is going to be another banner year for scammers. In Utah, last year, nearly 20,000 people reported fraud losses with nearly $40 million in losses. Next slide. So it may not be a surprise to any of you, but older people are not necessarily any more susceptible to scams, and in fact are less so. If you look at the yellow line, you see that the percentage of older people reporting that they've been scammed is much lower than younger people. But the bad news is that when they are scammed, they lose a lot more money. Again, they probably have more money to lose. And of course, they often have a retirement savings, so those losses can be especially devastating to them. Next slide. So fighting fraud is certainly a multi-pronged effort. There is not one single approach. Certainly educating consumers to avoid scams is critically important, and I'm sure that's work that a lot of you all are doing. But there's other elements to stopping fraud too. Certainly we need to encourage banks, payment apps and companies, telecom companies and others to adopt measures to prevent scams. And with technology, fintech, data, there's a lot that actually can be done to identify patterns and prevent fraud or detect it immediately and stop it. Certainly when consumers are scammed, we want to get them help right away. If there's help available, we need to enforce the law when there are protections that apply that protect consumers, and sometimes there are. And we also need to improve the law to protect consumers better and to give companies more incentive to prevent scams in the first place. Next slide. So the FTC, some people who reported fraud to the FTC reported how they were scammed, how the money was taken from them. And last year, in terms of number of reports, the highest number was credit cards. But in terms of dollar amounts, the biggest dollar amounts of fraud were taken by bank transfer or payment. So that includes bank-to-bank transfer services like Zelle, also bank wire transfers. But you can also see that cryptocurrency was a very close second there, approaching bank transfers in terms of the dollar amounts lost last year. Let's go to the next slide. And looking, the one before that. And looking at the first quarter of this year, we can see that cryptocurrency has now surpassed bank transfer and payments. Cryptocurrency scams are definitely exploding in an area that's we're going to need to dig into more and see what we can do to stop. Next slide. Now, no matter how the money is taken from somebody from a scam, the number one most important piece of advice is to complain immediately to everyone you can, because there may be lots of different places where somebody can get help, and you just want to get the word out as fast and as widely as possible. A really good first stop is the FTC. They've got a newish website, reportfraud.ftc.gov, and they will walk you through a series of questions and about how the fraud happened and give you advice. The FBI has an Internet Crime Complaint Center, ic3.gov, which is a really good place to go if you've had a large dollar loss and you've spotted it right away. They don't get involved in every case, but if a lot of money's been lost and only a couple of days or so have passed, sometimes they can trace the money and get people relief. You should also report to a lot of other places, state AG, file a police report. The Consumer Financial Protection Bureau is important because not only can they sometimes get people help, but they also are studying trends and informs how they go forward to improve the protections for consumers. And then of course you want to complain to the bank, the payment processor, or the gift card company, whoever was involved in any way in the scam. And I want to point out that one of the reasons it's important to report to the FTC, to the state AG, even if you can't get help right away, if the FTC, for example, locates the scammer, files an action against them, years later gets recovery, they want to give the money back to the consumers, but they can only identify the people who have filed the complaint with them. Otherwise, they're not going to know who was scammed. So getting those complaints in could, result in money back even years later. Next slide. Now, in terms of your legal rights, they really vary depending on what payment method is used and how it's used. So this is a very high level summary. There's a lot more details, but in general, you've got your strongest rights with credit cards, because you not only have protection if an unauthorized charge is imposed on your credit card, but you also have chargeback rights that allow you to dispute charges if you didn't get what you paid for, or if the payment turned out to be a scam. And that's under the Truth in Lending Act. A different law, the Electronic Fund Transfer Act, covers bank accounts and payment apps that can hold money. So that's debit card purchases, electronic debits from your bank account, person-to-person payments like PayPal or Venmo, bank wire transfers. You have protection against unauthorized charges. So if money's taken out of your bank account, and you didn't authorize it, there's protection under the law. But there's not protection against fraudulently induced payments. So if you were scammed into sending the money to a scammer from your bank account, the EFTA does not protect you. And then gift cards, cryptocurrency, cash, money transfers outside of bank accounts like Western Union. If you send money to a scammer that way, there's really very few protections. There are a few options I'll get to on the next slide, but not a whole lot. Next slide. So I wrote an article called Getting Money Back for Scam Consumers. It's on our website, and it goes through in detail the different payment systems and what your legal rights are. Next slide. So I'm going to walk through just a few examples of types of scams to explain what your legal rights are. So one common type of scam involves check deposits. Somebody is given a check and said, you know, deposit this check, keep part of it, and then send the rest to me. Or maybe the deposit comes in electronically. And the scam, you know, can take a lot of different forms. It can be mystery shopper scams. It can be, oh, I accidentally paid you $3,000 and I was only supposed to pay you $300. Okay, send me back the remaining $2,700. Consumer does that, and then lo and behold, the check bounces. Turns out it was a bad check. It was a non-existent account, or the payment is reversed, and you know the money was in the consumer's account, but the bank takes it back. Not a lot of protection in that situation. Banks do have a right to, you know, they may give you provisional credit for a deposit, but then they have the right to take that back. That turns out not to be good. And if you sent the money, that money is unfortunately probably lost. A tiny bit of wiggle room, maybe if the bank assured you that the check had actually cleared, then there's maybe negligence on the bank's back, and there might be some rights. But the fact that the funds were available in the account and that you could see them there is not the same thing as the check actually being fully cleared and good. Next slide. Okay, so in this example, a scammer tricks you into turning over the dual factor authentication code that allows the scammer to hack into your bank account. So, you know, they may call you up and say, you know, I'm the bank and, you know, your account's been compromised and, but, you know, give me this code and we'll take care of it. The Consumer Financial Protection Bureau recently clarified that this is an unauthorized charge and you are protected under the Electronic Funds Transfer Act. In other words, if the scammer took money out of your account without your authorization, the fact that you know, aided them by giving them that code doesn't remove your protection against unauthorized charges. Certainly you shouldn't do that. You should never give the dual factor authentication code to anybody. Banks will never ask for it on the phone. But if you do, consumer negligence does not prevent you from disputing that as an unauthorized transfer and getting your money back. Doesn't mean the bank will do it automatically. All the bank regulators have recently pointed out there's been a lot of violations of the EFTA, and sometimes you've got to really push the bank on this or file a complaint with the CFPB. But if it was a scammer that took the money out, you should be protected. Next slide. So this one involves Venmo, or it could be, you know, Zelle or another person-to-person service. The scammer tricks you into sending money to the scammer. As I mentioned before, this is what we call fraudulent inducement. You've been induced to send the money, but it wasn't unauthorized because you did send it, and that's not protected by the EFTA. And note, however, that we are trying to change that. We are urging the Consumer Financial Protection Bureau and Congress to extend protection to fraudulent inducement. Next slide. A Zelle scam we've been heard about recently, and Zelle, as people may know, is a service that is bank to bank. So a lot of banks will allow you to send money to other people through Zelle. So the scammer calls you, says, you know, I'm your bank and your account's been compromised, and to protect you, we need to move your money into another account. So just send it to yourself. Send it to yourself through Zelle, put in your own cell phone number and send yourself your money. Now, unbeknownst to you, the scammer has taken your cell phone number and linked it to their account. So when you send yourself the money, it actually goes to the scammer's account. This is a more ambiguous situation legally. There is protection under the EFTA for errors. You can require your bank to correct mistakes. I would argue that this is a mistake by the scammer's bank that allow your cell phone number to be linked to the scammer's account, and that you should, argue with the bank to correct that error. I don't want to mislead you that I think, the banks will say, oh, fine, no problem. But I say push it and, complain to the CPB. This is, another issue we're trying to get clarified. Final example, next slide. So the scammer hacks into your bank account and they take the money out of your account. You didn't authorize it, but they do it by wire transfer. So there's a number of different wire transfer services that the banks use, typically to send large dollar amounts, maybe to, pay a mortgage, for example, and make the down payment, pay off a home. FedWire is one of the key wire transfer services run by the Fed. Back in 1974, when the Electronic Fund Transfer Act was written, unfortunately, bank wire transfers were exempted from the EFTA. So even though that is an unauthorized charge, you don't have that protection under federal law to dispute it. You do have some protection under state law. The Uniform Commercial Code, Section 4A, which has been adopted, I believe, by every state, governs wire transfers, and it does have protection against unauthorized transfers like this, but they're weaker, and there's loopholes that banks can use to argue that the transfer was properly authorized. Now we're seeing a lot of these lately, and these can be really large dollar scams. These can be $10,000, $30,000, $40,000, even $100,000, $200,000. And there's actually, I've been in touch with a lot of lawyers. They're starting to litigate these cases to figure out exactly what UCC 4A applies. And so it's definitely worth getting legal advice in this situation. And here again, we're pushing to try to make sure that federal law gives you protection against these kinds of unauthorized charges as well. Next slide. So our work, involves, we provide testimony to Congress. We do a lot of letters and comments to regulators to improve the laws that protect consumers. I'd like to note that there is a discussion draft of a bill that the House Financial Services Committee has floated called the Protecting Consumers from Payment Scams Act. And it would add protection against fraud and the inducement, against wire transfers, and also against errors that consumers make, like if you sent money through, Venmo or Zelle, but you put in the wrong cell phone number. So we're hoping that that will move forward. And we're also, we also urge industry players to improve protections for consumers and to consider reimbursing consumers voluntarily. There's actually a program in the United Kingdom where the banks and payment companies got together with a voluntary code to reimburse consumers who are victims of scams in certain situations, because they realize that if people don't feel safe, they're not going to use these payment systems. So everybody's better off when consumers are protected. Next slide. So what you all can do to help our efforts, as I mentioned, send complaints to the Consumer Financial Protection Bureau, tell your senators and representatives to support protections against payment fraud. If you want information from us, you can sign up for NCLC news and webinars on our website, nclc.org. And we also have a listserv that I often send out payment fraud information on, our banking listserv, and nonprofits and government employees can join that listserv. So I think that's the end. And let's see.
You see the questions there, Lauren, a couple of them?
Yes. Okay, the first one is crypto fraud a big concern for the elderly, or is this a small group? I don't really know, to tell you the truth. This is a fairly new form of fraud that I have not had a chance to dig into. So yeah, I really couldn't tell you that. I got to say, I'm really shocked at how crypto is everywhere these days, and everywhere seems to be pushing people into hitting the lottery with crypto, which is, of course, extremely dangerous. What is a dual factor authentication code? That is when, let's say you're going to log into your bank account, your online bank account, and instead of just putting in your password, you can set it up so that there's a second authentication method, like they text you a code to your cell phone number that you need in order to get into the account. So there's sort of two checks before somebody can get into an account. It's also sometimes something that is triggered if the bank detects somebody logging into your account from a place that's unusual and they want to verify it's really you. They might send a text to your cell phone if you've got it, linked to your account with a code, and they might ask for that code in order to get in. So that's a check against scammers getting into your account. But then, of course, if the scammer calls you and you give them that code, they're going to get in. One of the biggest gaps is helping victims collect from the scammers. Any assistance there? Yeah, I mean, the problem is that scammers, they're gone, right? I mean, they're, it's whack-a-mole. They scam one place and they leave. They could be overseas. They receive money in one account. They shut that account down. They use another one. I think reporting to the FTC and state attorneys generals is really the best thing to do there, because they are the ones going after those scammers, and then if they get some money back, they can reimburse people. The CFPB also, because they also have a reimbursement fund that is potentially available. Let's see. I don't work with my clients' financials. If one brings up they think they've been scammed, who do I contact? Because I feel my hands are tied in a professional capacity. Well, there are certain lawyers who can help if they are low income or elderly. Legal services programs may be able to help them. If it's a larger dollar amount, private lawyers, the National Association of Consumer Advocates lists lawyers by state on their website. I don't know if credit counselors, other kinds of groups would help with this sort of thing. That's the last question I see. Anything else?
Lauren, thank you for that great overview, sobering information. We appreciate you taking time to be with us today, and all the best in your work on the national level as well. Look forward to partnering with you. Grant, we're going to turn the time over to you to share your story, and appreciate you stepping in on fairly short notice to participate in the event. Thank you, Grant.
Oh, I just thank you, Rob, for inviting me and let me share this story. This is a story about my mother-in-law. My wife's Mary. It was her mother, and she was just a small, kind woman. She never said anything bad about anyone. She lived over in central Ogden for many years. Her husband passed away quite a while before. Velma's mother, Velma was the mother-in-law the guy would only dream about. Velma had a daughter and a grandson who were living with her. They had some substance abuses, so they stayed there off and on all the time. Her home wasn't very large, so they made do. Velma was in her 80s, and she would still go to work a couple times a week. She cleaned old people's houses. She said it was old people, but she was older than they were. She would go out and she'd catch the bus and take it to South Ogden, and it didn't matter whether it was rain or snow or what. She always had her, if it was raining, she had that little plastic hat on that older people would always cover their hair with. And she was always there and always did the work. She had a small income of her Social Security and a small pension from the Carpenters Union from her deceased husband. And her home was paid for, so she didn't need any money except for pay the utilities, the taxes, and a few groceries. Velma had her banking statement sent to her other daughter, Joanne, and sent it to her house because she didn't trust her roommates. And so one year at Christmas, her husband, Hank, was opening up all the mail and opened it by mistake and opened it. And he discovered that there was $40,000 in this account 2 months ago but now it was down to 33,000. And so he spoke to his wife, Joanne, and came over and talked to Mary and myself. And we never even knew that she had a $50,000 life insurance policy from her deceased husband. And so this was just all news to us. So we went over and talked to her and asked her, where's this money gone? And she said, well, I just needed it for a few things. And she would not go into it at all. Well, before one of the withdrawals was for $4,000. And before the withdrawal, her daughter, who was living with her, called our home and she left a message on her answering machine asking if we knew any rich people that could give them $4,000 because her son, Velma's grandson, needed an operation on his throat, and they had to give the doctor $4,000 up front. And if they didn't, he was going to be paralyzed for life. And we figured that Velma was sitting right there next to her when she was leaving the message on our phone. And we're sure that Velma said, oh, I can give you $4,000. Don't want my grandson to be paralyzed. And so we got a call later that evening, and it was left on the answering machine. We were gone all day. And she said, oh, we found someone who would give us the money. So thanks a lot and goodbye. Well, Velma was taken down to the bank, and her grandson took her up to the teller's window, and Velma said, well, I need to get $4,000 cash out of my savings account. And the teller asked her, said, Velma, are you sure you want to withdraw this? And as she had seen the grandson come in a few times before and get her to withdraw money. And he leaned over to her and whispered in her ear, yes. And so she said yes, and the teller gave her the money, and that was, at the time, that was all that she could do. And things have changed a little since then, and I'll discuss that a little later. My wife and I and sister-in-law and Hank, her brother-in-law, we discussed it, and we had no idea of what to do. And we talked to the police, and they said, you need to call Adult Protective Services. And that's what we did. And they came right out. They spoke with us, found out some information from us, saw all the money that had been withdrawn from her savings account. And then they went over and they talked to Velma. They talked to her daughter and grandson and all. And they came back and talked to us and said, there's really on this, there's nothing that we can do for the fact that she gave them this money voluntarily, but we do think that she was just scammed out of it, as they had looked at when we told them about the operation and the $4,000. They went into DMV and saw that the grandson had registered a pickup that he had purchased for $4,000 the day after they got the money. So I guess, you can get an operation and a pickup all at one time. Well, Joanne, her other daughter, was the power of attorney, and APS was able to show us how to stop the bleeding. We moved the money out of an account, so it still needed one of the signatures or two people. And so that was when we began to paying the utility bills from her account, give her what money she needed, but none of the money went to her roommates. And this infuriated them. Velma was sleeping on the couch as her son had moved in also and was in her bed. She fell off and broke her pelvis in 3 spots and had to go to the hospital for a few days and then rehab. And her social worker said that she would not be able to go home without having some work done to the house as far as safety bars in the bathroom, in the shower, and a ramp so she could get in and out. And the roommates were not willing to do anything. They just wanted her to come home and pay the utilities. Velma was moved into an assisted living place, and the roommates would visit, and they would tell her just this is just awful. They're treating you so bad. You just need to come home. And of course, she always kept saying, I need to go home. And they needed somebody to pay the utility bills. Her remaining money ran out, and she was in a nursing home so she could receive care 24/7. The former roommates, they would come by once in a while, but after they left, she was so depressed. And when they finally quit coming to visit her was the time that she really enjoyed the last 5 years of her life. We don't estimate that she would have lived in her home for more than 6 months without being broke and dying there, which would have been terrible. One of the roommates got one of her smaller retirement check that wasn't a direct deposit, and they forged her signature and cashed it. And it took us a couple of months going through the banking and all for the police to come talk to them, and they refunded the money. But the police didn't do anything to them either for the forgery, because they couldn't tell, who forged the system or her signature and all. The banking system in Utah has set up some different regulations so that the tellers are able to, if they suspect fraud, they're actually able to say something about it. Western Union was sued by the federal government for sending all this money to other countries from unsuspecting seniors. And they got that to stop. If I had a lady that I talked to at a group that said, I went to Western Union and I was going to send my daughter some money at Christmas time so she could get her and her husband and the kids some gifts. And it was like I was in the FBI lineup. They were questioning me so much. So it has changed an awful lot and really helped. Walmart even questions if you're sending money or if you're purchasing all these gift cards from iTunes to send out. There's been a lot of protection done since the scams and frauds go after over 60% of our seniors and family members are the ones who get scammed by their family members or close associates. 3 weeks before I retired, I saw an ad in the Ogden paper asking for volunteers for elder abuse. Well, I called and spoke to the head of RSVP volunteer group in Davis County, and I signed right up. Had to do the fingerprints, the FBI background check, and the drug test. And I thought, how great is all of this to try and help protect our seniors from people who could possibly come out and talk to them and gain their confidence and take their money. I started going out to senior centers, assisted living homes, and I even went out to a family home evening of seniors one Monday night. And I'd normally talk for 20-30 minutes about the local scams, the ones that I've been familiar, the ones they keep calling me about. And then we would take some questions. Davis County supplied me with a little giveaway folder called Pass It On folder. And it has all sorts of information about some of the scams I was talking about, other ones. And one of the things that I did was I put phone numbers of where to call, who to call, the FCC, the Adult Protective Services, different things, because the seniors, they come across this stuff with their neighbors, their friends, their family, or of course, none of them that I'm talking to are getting scammed, but they are seeing it with other people, but they don't know where to call. And when somebody calls and wants to access their computer and they're not sure, they don't know who to call and check and see. And so I include also the AARP Fraud Watch toll-free number, which helps them to, is it okay to send these iTunes gift cards, or Is this a fraud? I also remind our seniors that this folder that I get them is called Pass It On. And that's exactly what it means. Pass it on, read the information, write down the stuff that you need and give it to your neighbor, give it to your friends, give it to people who might not know about some of this stuff that's going on. One of the biggest things that I feel is that our seniors need the education. You know, they grew up at a time when a handshake that's all we needed. We didn't need a contract. We didn't need to talk to our lawyer. We trusted everyone. The only time we ever locked our car was in the fall, and that was so our neighbors wouldn't fill it up with squash in the fall. I think if we educate our seniors and help supply them with the resources and where to respond, we might be able to help them save their hard-earned money. Our police forces are also doing more training and for things to look at. So the reason we keep getting those emails and those phone calls, it works. Somebody is sending them money, so it works. So if we can help them so that they don't send their money, then that's where we go. And I don't know if there's shouldn't be any questions. We all understand this fraud. Is there anything else that you'd like me to add, Rob?
Grant, thank you. First of all, for being so open and vulnerable about your family story and for taking the time to pass not only your experience, but to give your time to help other individuals in the community. It's deeply appreciated. You continue to volunteer and add a great deal to the cause. So thank you. Some nice comments about folks appreciating your efforts and a little bit about the Davis County RSVP program and an individual appreciating you as an amazing volunteer. So the question from Jamie is, was your mother-in-law Thelma or Velma?
Velma with a B. And there was also Utah, forgot the Utah Commission on Aging got a grant to do a video to try, and it's very, it really explains what and all happened, and it was very professionally done, and it was on YouTube, elder abuse, Velma's story with a V.
Yeah, and it's still there, and that is the same site where this program recording will reside in a few days. Thank you, Grant. Return the time now, our concluding speaker, Candice Daniel. Candice, I'm going to go ahead and put your slides up and you can introduce yourself and bring us home.
Wonderful, thank you. Thank you for the opportunity to be here. This is a really critical issue and I'm honored to be among the panel. So I am a clinical psychologist and my background is in aging and geropsychology. My goal for this presentation is to end the conference on a hopeful note and discuss resilience. I'd also like to include practical opportunities to intervene, as well as advocate for Kathy's call to action. Next slide, please. I have no financial disclosures to report. I do not represent the VA. I am an employee with the Salt Lake City VA, but rather this information is my own expertise. Okay, so as we've already discussed, elder abuse is recently studies have suggested that it has increased not only across the state of Utah, but we've also seen evidence nationally as well as worldwide. Types of elder abuse that have seen significant increases include physical violence, neglect, as well as financial abuse. And so I think that there was one study that reported that there was nearly an 84% increase in reports of elder abuse just in this past year. Next slide. So I'm going to spend some time talking about resilience. Resilience is the human capacity to persist, bounce back from, and flourish in the face of stressors or adversity. It consists of both recovery and sustainability. So recovery involves how quickly and completely that you are able to bounce back, but also the capacity to move forward despite future challenges. And so what we do know is that the response to trauma most commonly is resilience. And in fact, many people find that they have new strengths. There is some research that came out recently that suggests that older adults tended to fare better under isolation than younger adults in terms of mental health problems, including PTSD, depression, and anxiety. And so aging takes strength. And I want to emphasize that there are a lot of amazing qualities among our older adults. Next slide, please. So I'm going to spend a little bit of time talking about resilience across multiple contexts. I think that this lens can provide us with an opportunity to highlight multiple areas of intervention as well as opportunities for prevention of elder abuse. And so what I'd like to spend a little bit of time on is discussing the opportunities to intervene at each of these levels: individual, caregivers and family, neighbors and community members, healthcare and social service professionals, as well as stakeholders and policymakers. And it's also important to consider the multiple areas that are impacted as potential vulnerabilities. So considering physical, emotional, cognitive, and financial vulnerabilities. Next slide. So when we're looking at risk and protective factors among individuals, something that's come up time and time and again is financial strain is associated with risk of abuse. This has been found to be correlational, and I think the relationship is complicated because it is also considered a form of abuse. Several protective factors have been identified, including physical distancing. In the recent years with the pandemic, they found that actually physical distancing has been a protective factor. But also it's important to balance limiting isolation, and we'll talk more about that in a minute. Staying busy, so staying engaged, maintaining a regular schedule is important. Seeking social support, so even though older adults may be limiting their interactions, they're also continuing to engage in other ways. Positive mindset and emotion-focused coping has been found to be a protective factor, as well as maintaining their daily routines. And next slide, please. So among caregivers and family, it's important for caregivers to seek support, ask for help. For any of the caregivers that you know, it's important to normalize that you can't caregive in isolation. It's okay to ask for help. There are some really wonderful caregiver support groups around our state. We do have opportunities for respite as well as adult day centers. And I think encouraging people to ask themselves about burnout. So what are the signs and symptoms of burnout? Could I be experiencing burnout? One of the signs that may be a little bit too late could be something like irritability or shortness, something like that. So looking for signs of burnout among your caregivers and not being afraid to openly talk about it. Next slide, please. Among neighbors and community, so programs that support a sense of community and are accessible to older adults are truly important. So supporting funding for senior centers, midday meals, libraries, activities, as well as volunteer opportunities are tremendously important to help older adults feel connected to their community. Additionally, education about the frequency and the common occurrences of elder abuse is also really important. Talk to your friends and neighbors about it. Ask questions. It's okay to ask questions about it. I did see some statistics that, you know, it might be higher than 1 in 10 older adults are now experiencing abuse. So don't be afraid to educate your neighbors in your larger community that this is a common problem that needs to be addressed. Next slide. And for those healthcare and social service professionals, make sure you ask about abuse and neglect and think in terms of these multiple domains. So not only looking for signs and symptoms of physical abuse, but are there any signs and symptoms of emotional, cognitive, and financial abuse? And ask, maybe looking for vulnerabilities among your patients for any risk factors. Also educating against ageism. So this is a resource that I really have found very, very helpful. It's oldschool.info. And it's a repository to sort of push back against ageism and sort of advocate for older adults to be valued and speak out against ageism. Familiarize yourself with resources. The state of Utah has some really tremendous resources in terms of our local agencies on aging, as well as adult protective services. And there are many financial resources that have been cited today. I would encourage you to have those on hand so that you can hand them out, educate. And then recognize that people are variable. So while the common response to challenges is resilience, that there's going to be a wide variability in how people respond. And so not being open to people experiencing adversity differently. And then the next slide, please. Stakeholders and policymakers. So advocating for programs that support older adults in our community, advocating against ageism and educating people about the resilience and contributions of older adults. And not to forget, these are very valued members of our community who have a lot to contribute. Support infrastructure and education regarding virtual visits to reduce potential isolation, and maybe education around using technology, things like that. And then my next slide is just a few references discussing the increase in elder abuse within the context of this larger pandemic. And then finally, my contact information is on the last slide. I can be reached at this email. And maybe we can open up this time for questions or comments. I want to thank everyone for their attention to this really important issue. And thank you for allowing me to be here.
Okay, lots of thanks to Candice for great information. Any questions for Candice or for any of the panelists? All right, well, thank you all.
I have a question, Alan.
Yeah, go ahead.
So Candice, you said you recently ran across some evidence that talked about, the increase of greater than 1 in 10. And I think I've seen some data as well as like during the pandemic, going twice as much. In fact, almost 1 in 5 reporting incidents of abuse. Has that been something that is consistent with what you've seen as a result of increased isolation relative to the pandemic? And what are there any additional strategies you would have people be aware of as we're trying to work our way through this? And we have our own sort of post-traumatic stress from this pandemic that we're worried about what's around the corner, and hopefully see this trend the other way. But just any additional thoughts about additional concerns relative to the experience we've been through with increased isolation?
I do wonder if the large increase in financial exploitation could be due to increased isolation. People are lonelier. They may not be reporting, more clinically significant mental health issues, but the loneliness may render them vulnerable to financial scams. I also think that people are under a great deal of stress. And when people are under stress, they may tend to engage in emotional or physical abuse tactics, which under less sort of pressured circumstances, they may not otherwise.
Grant talked a little bit about, and others did, about the affinity fraud, and we're all aware that that's a very big thing, and it's the highest preponderance of perpetration. And there's this term, and it's probably again familiar to the group here, called the trusted others. And I say trusted with those quotation marks, in that is the trusted others really come out to play when isolation increases. Those are the ones closest to a potential victim with less oversight because of the isolation. And we have to be so vigilant that the opportunities are greater when isolation increases for those trusted others to do inappropriate things. So. Thank you, Candice.
Thank you.
Any other questions that anyone has to raise? Okay, well, I want to thank you for this remarkable conference. I've learned a lot myself, and it's been an incredibly good meeting. I really enjoyed all of the incredible presentations that were offered. I want to thank all of the folks who did participate in this. Kathy Greenlee she's the Senior Director for Elder Justice Programs in Advancing States. I want to thank Lauren Saunders, Associate Director, National Consumer Law Center, Grant Johnson, a volunteer from Davis County Coalition of Abuse Prevention of the Elderly, and finally, Candice Daniel, clinical psychologist, board certified in geropsychology. Thanks to each of you for attending today. I hope you will all take advantage of the incredible resources that are presented here today, and with Adult Protective Services, the Commission on Aging, AARP, Alzheimer's Association, the area agencies on aging. Take advantage of these wonderful people and these amazing resources that are available to you. And I hope each of you will have a great day. Thanks and goodbye.